You can often find Autumn Emmy out on the softball field. She's been playing the game since she was 5 years old.
I played little leagues, and then I just all the way up 8U, 10U, 12U, 14U, 16U, 18U.
But for the last few years, she's been dealing with shoulder pain that has become more persistent.
I've had it since I started to change my throw when I first joined a travel team. And it got to the point where it was starting to affect my ability to play. And I had a really hard throw. My arm would basically feel like it was falling out of its socket. And if I tried to lift up my arm, it did not feel the best.
She decided it was time to get it checked out.
She plays a lot of softball, so she's always swinging her arms around. And so shoulder instability is typically loose ligaments. And so this was her dominant arm. And I think just over time, her shoulder got loose. She didn't have a specific injury where her shoulder dislocated, so it's a little bit harder to diagnose. We got some x-rays, which were normal, but she hadn't done any really formal physical therapy. And we tried to rehab her with physical therapy and non-surgical management.
A few months later, Autumn was still having pain.
We got her into surgery. It's a shoulder scope, so it's small incisions around the shoulder, about 1 centimeter big, and we introduce a camera inside so we can look at everything. So it's a minimally invasive surgery, which is nice. When we got in there, I could actually move the shoulder back and forth, and it would dislocate anterior and posterior and inferior. It was just coming out of the socket, the entire thing. So we had to end up stabilizing it. And what you do is you tighten up the ligament and the capsule and the labrum, and you bring up that tissue and you drill little holes about 1 millimeter in size into the socket, and then lift the tissue into those little holes. So it props the shoulder back up.
Next, it was time for rehab and recovery.
The first 6 weeks you're in a sling, supported all the time. Now you'll take it off a few times a day to move your elbow up and down. After 12 weeks, we strengthen as tolerated. It takes them about 3 months to get their strength back to where they like their shoulder. So it's a good 6-month rehab.
Autumn is now past the 6-month mark and is back on the ball field. She even received an MVP award at one of her recent tournaments. What is even more exciting is she will now be able to play softball in college.
I'm going to go to Nebraska Wesleyan University to play hopefully another 4 years of college ball and study pre-med and minor in business. I don't have any pain, so I've been able to throw for the first time in 7 years without pain, and it feels great. I can do a lot more things that I haven't been able to.